We're picking up in Module 11 here with, what in the world? Picking up, oh no, don't do that. Picking up in Module 11, let me make sure my little pen is working again, and with benign prostatic hyperplasia. Okay, what that means is hyperplasia as in it's getting more cells, but now because the prostate is actually enlarging, it's benign. It should not. It's not a cancer or anything like that. It's your prostate is just growing and getting bigger. If you look at this drawing down here, you will see where the prostate actually kind of goes right around the urethra. So if urine is trying to get out of the bladder and be excreted out of the body, and this prostate keeps getting bigger and bigger, then as it gets bigger, it's going to cut off the flow, as you can see from these little arrows here. It cuts off the flow of the urine. Well, that is a problem because now you get a backflow or back pressure, and that's going to stretch the bladder. It's going to make it painful. It's going to make it difficult to urinate because of that blockage, I guess, is what really is. Okay. Problem is they say 80% of men will have this prostatic enlargement before 80 years old. Not that most men make it 80 years old, considering the average life expectancy for males in the United States is, what, 74 to 76, depending on different factors. Obviously, women can't have BPH because they don't have prostates. Okay, causes. Well, decreased testosterone, okay, is a cause of this. Apparently, the testosterone hormone actually keeps the prostate at a relatively small size, and this is actually not estrogen. It's epitestosterone. Okay, so you'd have increased epitestosterone ratio. Signs and symptoms. Okay, usually over 40. Okay, that would actually be fairly early for an enlarged prostate, 40, but you're supposed to get a prostate exam by digital rectal exam, as in, yeah, you guessed it. Every year after 40 years old is the recommendation. Okay, because of course benign prostatic hyperplasia isn't the main problem. The problem is if it turns into not benign, but prostate cancer. Okay, so every year after 40, make sure you get your digital rectal exam to start with. Of course, the prostate-specific antigen, the PSA, that actually is a antigen specific for prostate cancer. So that you do want to actually get in your blood test fairly regularly after you turn 40, just to make sure you aren't getting prostate cancer. Okay, as I said before, the hesitant, interrupted, or weak stream of urine is because of that clamping down on the urethra from the prostate, pushing on it, which means that you're going to want to go more often. You're going to think you have to go right now because of that, because you can't get all of the urine out when you are trying to go. Okay, nocturia just means that you are going to if you think about it, you constantly have a full bladder is what this is really talking about. So you're going to your bladder is going to want to empty 24 hours 7 days a week, and that includes while you're trying to sleep. Okay, and of course that's why you get the leaking and dripping. It's going to try to get out whenever it can. Okay, you can always do a biopsy to check for prostate cancer, but again, you'd probably want to do the PSA first, because that's a pretty good indicator of whether you have prostate cancer or just BPH. As far as the treatment goes, actually a lot better on that recently. Do have some medications that are pretty decent for BPH. I don't know about the homeopathic ones. They definitely advertise them a lot, but I really have no idea whether they work or not. Surgery is probably not your best option, at least at first, because you don't really want to do surgery on anything if you can help it, but you want to start with the medications, bring it down, maybe even laser, try to bring that down. You get into prostate cancer, then surgery you could certainly look at, but there's also radiation where they have these little pellets that even if it's prostate cancer, they can put the pellets right in there and they're radiated, and we're talking about prostate cancer now, but that would also shrink that and get rid of the cancer itself. Okay, that's another picture of where everything is. Okay, again, the prostate is literally right there where the urethra, in between the bladder and the penis where it's coming out. Okay, same thing right here. This is the rectum or the anus, where you can actually feel it right there. If it's getting big, it's going to push on there too. Okay, and you can feel if it's large. That's what the digital rectal exam is. All right. Neurogenic versus overactive bladder versus stress incontinence. So we're talking about three different things here. Neurogenic. Okay, what's neurogenic? It means it is coming from the nervous system. Okay, flaccid or spastic. Okay, you hear that like in I don't know, convulsions or something like that, or paralysis really is where you hear a lot. Flaccid just means weak, or yeah, I guess weak, as in if you have a paralysis and you have flaccid paralysis, that means that your muscles are limp. Okay, I guess that's probably a better word. Spastic just means really tight, as in really tight spazzing muscles. Okay, so it can be either or, because there is nervous system that does control the bladder, and if there is a problem with the nervous system, it could go either way, either flaccid or spastic bladder problem. Okay, well, it's either unable to relax or the sphincter is unable to close. In either case, if your bladder can't relax, then it's going to constantly want to push it out. Okay, and if your sphincter is unable to close, then it's going to constantly want to push it out, right? Okay, so what do we have here? Our sphincter muscles relaxed, our sphincter muscles squeezed shut. Okay, so let's look at that. If your sphincter muscles are squeezed shut down here at the bottom, then obviously no urine is getting through that. Yes? Yes. Okay, if our sphincter muscles are relaxed, then of course urine can flow all the way through. Okay? So that's what we're talking about. If you're, I actually said that backwards, didn't I? When I was up here. That's why we check it. Bladder unable to relax. Okay, if it can't relax, then it can't let the urine flow, because the sphincter muscles have to be able to relax to let it flow. All right. I'm actually talking about two different things is what's going on. We're talking about the bladder versus the sphincter. So I was correct the first time, so just kind of ignore that. Okay, because if the bladder can't relax, then it is spazzed up. Okay, and if the sphincter is unable to close, then you're definitely going to have a flow. Okay. Anyway, why? We already said it's neurogenic, so you're talking either to CNS or peripheral nerves, which are your only two options, and there could be damage to them. It is a nervous system issue. Urinary incontinence, as in not being able to control it with constant dripping, is the problem in either of those cases that I went back and forth on. Okay. Overactive bladder. Well, just like it sounds. Your bladder is literally overactive, and if your bladder is overactive, you have these contractions that should not be happening nearly as frequently as they are happening, and of course that can cause incontinence or a lack of voluntary retention of urine. Okay, so leaking, dripping, that sort of thing. Well, this is very much like the neurogenic bladder, isn't it? Because it could also be because of neurologic problems like Parkinson's or multiple sclerosis are nerve problems that also manifest physically, but these nerve problems could lead to an overactive bladder where it's continually contracting and contracting and contracting, okay? The last one, stress incontinence. Okay, this is the one where you've seen maybe in someone where they laugh really hard and wet their pants, or cough and wet their pants, or sneeze, or lift something really heavy. Any kind of increased pressure is what we're talking about. If you have an increased pressure and that causes you to urinate, then we're talking about stress incontinence. Okay? In either of these, which is all of them, the neurogenic, overactive, and stress incontinence, the signs and symptoms are like a UTI, as in you could get a UTI also from these, because you have the inefficient flow one way or the other. Either if you're holding your urine too much, then it could cause bacteria to gather in there. If you're urinating too often, it gives more of an opportunity for bacteria also to get in there. If there's leakage, or for any reason where you're getting an opening there that there should not be opening unless urine is coming out fully, you know, bacteria can kind of just sneak on in there and cause an infection. Okay, how do you test it? Well, clinical obviously is, you know, looking at how often they are urinating. You could do a pelvic ultrasound to see if there's any kind of damage in there, or thickness of the wall, or whatever we're looking at. And you do want to rule out a urinary tract infection, because obviously a urinary tract infection could turn pretty bad if that's the only reason you're having these incontinence kind of symptoms. Switch gears a little bit. Now we're looking at the bowel instead of the urinary tract, right? So diarrhea. What is diarrhea? I think everybody's familiar with what diarrhea is. If you have it for more than 4 weeks, it's called chronic diarrhea, which would be unfortunate. The causes, boy, pretty much anything can cause diarrhea. Irritable bowel disease, which we'll talk about at the end here, ulcerative colitis, Crohn's disease. We talk about all of these. I don't think we actually talk about celiac disease. Unfortunately, we probably should. That's that or the sensitivity to wheat protein in there, and you can certainly get diarrhea from that by ingesting wheat gliadin, or gluten is what most people refer to it as. All right, so this is where you have the gluten. They call it a gluten allergy. It's not actually an allergy. It's an immune system problem, but either way, it can cause diarrhea. Okay, actual food allergies definitely can cause diarrhea. Artificial sweeteners, sorbitol, for example, are another example. And anything that infects the intestinal system, viruses, bacteria, parasites, all of these things can cause diarrhea. In fact, some of the worst diarrhea in the world is from viral bacteria or parasites that get in there. Believe it or not, people die quite often from diarrhea. Usually not in the United States, but worldwide is actually a major problem from things like cholera and stuff like that are dysentery. They're so bad, diarrheas, that people die from them. They dehydrate themselves. Okay? And of course, you know, just from travel, you can get diarrhea because, you know, in one location, geographic location, the bacteria that are normally in your stomach and your gut, your intestines, are different than in some other place, and when you travel, sometimes that can cause it, even though you haven't actually ate anything or drank anything that was bad. Okay, although certainly food can give you diarrhea with food poisoning, or getting some kind of bacteria or something, parasites or something like that. If you look at antibiotics, a lot of them have on their possible side effect is diarrhea. Actually, a lot of drugs, period. Okay, What is diarrhea? I think we kind of know that. Frequent loose stools, you get abdominal pain and cramping, sometimes you get fever and chills, malaise, really tired, dehydration, of course, and depending on how bad and what's causing the diarrhea, bloody stools. Okay, that's a pretty bad diarrhea when you have it because they're bleeding. How do you do it, or how do you test it? Well, you want to run a culture to find out what's going on in there, what's actually causing it. You might want to do an ova and parasite test, O and P test, to find out if you have any parasites. Okay, and Giardia is one of those little parasites that you would get from drinking mountain spring water that hasn't been run through any kind of filtering system. Of course, you can do a CT to find out if there is some mechanical problem going on in there, and of course, a rectal exam, although why you're getting diarrhea, I'm not sure how relevant a rectal exam may be. Okay, constipation is obviously the opposite of diarrhea, and that's where you have less than 3 bowel movements a week, which is not very many. Okay, dehydration is a big one. Not getting enough water, you're not going to process the food through the bowels. Okay, not having enough fiber. Fiber is a bulking agent, and it pushes food through the bowels. So if you don't have enough of it, which many of us do not, then that will certainly cause constipation. Age, of course, is a risk factor for everything. Decreased exercise. Exercise, of course, is a good thing for every disease, you know, to help prevent it and help it, and sometimes even cure it. Okay, pregnancy, get constipated from pregnancy. A lot of that is mechanical. If you have a big old fat belly pushing, or some baby's head, you know, pushing on that thing, then of course you can actually cause a stoppage in there, and that would cause constipation. And of course, medications which can cause constipation or diarrhea, depending on the medicine. All right, it hurts, and you have to strain, you have to work really hard to move stool with constipation, obviously, and then bloating, because you're getting bigger, the bigger the buildup in the bowel is, right? Okay. Test for constipation with a sigmoidoscopy or colonoscopy. Okay, it has to be pretty bad constipation before you want to start sticking tubes up there and looking around with cameras, but sure, you could do that. That's an option. Enema would probably be a better, faster option, where you just basically shoot fluids up there. That's what this is actually, is a barium enema, where you shoot the fluids up there, and then you start looking through the bowel to see what it lit up, because there's barium in there, and you know, maybe you'll find that maybe it was twisted or something, and that's obviously a huge deal. Maybe you'll just find a big bulky garbage of stuff, you know, all clogged up there. Who knows what you're going to find, but that's what a barium enema is. So it's kind of like an x-ray of the bowel. Okay, we have inflammatory bowel diseases. We kind of threw them all in the same category. That's what I was trying to think of earlier, is inflammatory bowel disease, not the same as irritable bowel disease. Okay, diverticulitis or diverticulosis before that, ulcerative colitis, and Crohn's. These are really interesting, and I'm going to save them for the next video so that we're not getting these videos too big.